We are on YouTube Live now. Hello, everyone. Thank you so much for joining us today on our very first segment on food we eat. I'm Dr. Kalindi Bakshi, the host and founder of Plantology Fuel. I'm a neuroscientist by training and a medical professor turned into founder of Plant-Based Meal Company. In Plantology, my mission is to bridge the gap between scientific knowledge of nutrition and what actually we bring to the plate, practical solution, bringing nutrient-rich meals that we can enjoy, all of us can prepare with simplicity and enjoy the healthful benefits of that. So that brings me to the topic of discussion today, food we choose can make us or break us. March is the National Nutritional Month, which makes it a perfect choice to talk about our favorite topic, food. So Food We Choose is in collaboration with World Vegan Vision, a non-for-profit organization whose mission is to empower you to get your health, benefits about get your health with knowledge and about vegan diet. So all of us have gathered today. We are bring together our perspective on how food we choose affects or it determines the outcome of what we are. So let me start by introducing the panel. First and foremost, Dr. Shah, Dr. Shrenik Shah. He's a physician with over 35 years of practice in internal medicine. He's the president of World Vegan Vision, and he has been a vegan over 20 years. And his mission is to spread the love of whole food plant-based diet. During his practice, he used a very unique approach. He taught his patients the perfect balance between eating the right food and reversing, managing, and preventing chronic disease. So he used a very simple but a very effective tool. As a firm believer and follower of whole food plant-based diet, he guides his patients and people around him let food be your medicine. He strongly recommends whole food plant-based diet for prevention, reverse, and managing disease, and also for a healthy mind and soul. He has ran 6 marathons. He's an avid hiker and a practitioner of yoga and meditation. Welcome, Dr. Shah.
Thank you. Thank you all.
And our next guest is Anuj Sood. Anuj is a data scientist who has spent 15 plus years analyzing healthcare data for insurance companies. So he comes from, looking at data trends, looking at hidden trends and predicting health outcomes of what these trends are. He's involved in creating strategies and initiatives to help individuals and guide them towards a healthier life. Anuj is also a health and fitness enthusiast. And as a data-driven, data-oriented individual and professional, he suggests making life choices driven by scientific data and not by simply Googling or not by facts, right, in diet. And our next guest, which is Coach James DeMaria. Coach Jim has been a fitness coach at CrossFit Ignite for 11 years, and he is also a certified personal trainer. As far as professional, he is actually a nurse of cardiopulmonary and orthopedic unit. And more to his adding more to his bio, he is a drummer. He is drummer for 2 touring heavy metal bands. So welcome, Coach Jim.
Thank you so much for having me, Kalindi.
So today we are all going to bring our own perspectives and our own experiences, personal experiences, and experiences in our respective fields, and we're going to connect it to food and chronic disease. So, let me start just by answering the first question. What is chronic disease, right? So a textbook definition or definition according to Center of Disease, CDC, is broad disease. Chronic disease is something, condition that is, prevailing condition that lasts about a year or more. And condition that requires constant medical attention. It limits your daily activities, and you may have to be on medication for a longer time. So some of the chronic diseases, heart disease, cancer, and diabetes are actually leading cause of death and disability in the country. And to say the least, they are the drivers of trillions of dollars in annual healthcare cost. Some alarming statistics: 6 out of 10 adults in the United States have chronic disease, and of that 4 out of 10 have 2 or more chronic diseases together. Well, what's the good news? Or on the brighter side, there is tremendous amount of evidence. There is scientific data as well as clinical evidence, which points to the fact that chronic disease can be controlled. It can be controlled and managed just by altering one's lifestyle. And that is by choosing the right food, choosing the right nutrition which supports your body. So let's start. Without further ado, let's start our topic.